Hello, everyone. Welcome again. And I am still at the 33rd International Congress of Psychology at Prague, the capital city of Czech Republic. Friends, today I have a very, very interesting person with me, Frantisek from Poland. He is a PhD student and he is doing his research on the quality of instructional videos. So, Frantisek, what is it actually that you are doing in your PhD research?
So a lot of research is focused on how to create instructional videos, but it's mostly focused on the cognitive side. It's focused on how do we want to control the attention of viewers.
Yeah.
I'm more interested in the emotional aspects. So I want to see which emotions predict the most knowledge gain. So what I want to do is measure very different emotions created by an instructional video that people will watch and see which of them predicts the most knowledge gain, how much people learn by viewing this video.
Okay. And what is the conceptual framework that you are using for this? I'm reminded of Albert Bandura's research when I speak to you.
Yes, I'm thinking about Albert Bandura's research. I'm also taking a kind of neurobiological approach. So
Okay.
there is a lot of research that shows that strong emotions make more memorable content.
Correct.
And this has influenced me the most, I think, those neurobiological theories.
Yeah. And what emotion have you found out is getting correlated with engagement and memorization?
So I could say that there are those emotions we could consider pure emotional states,
Okay.
but also those who are a bit more complicated and have more aspects.
Okay.
So, for example, that's why I like to use the word affective states generally.
Affective states. Yeah. Instead of just emotion.
Yes.
Yeah.
And there is immersion. So, how much a person is inside the world that is shown by the movie.
Yeah.
In their mind,
Yeah.
but also among those simple emotions, simple affective states, we have, for example, joy.
Yeah.
When people experience joy, they
simulate joy.
Yes. When people experience joy, they remember more from a video, for example. So immersion and joy are very important. Surprise has been shown to be very important. Surprise has been related to something that's called attention grabbing.
Yeah.
And people, when they are surprised, they will focus their entire
they'll
attention.
be very curious and they'll engage with the video more as to waiting for what is going to come next.
Yes.
And that's why the suspense thrillers and all those movies are so popular.
Yes, exactly. I was inspired by movies where the most memorable moments were those that surprised me the most.
Yeah.
Like, for example, in Hitchcock's Psycho.
Yes.
That's a very memorable moment because it was so surprising.
Yes. So anticipation, you mean to say, is one affective state that is going to create a lot of
that too. Yes, yeah. I'm going to study anticipation and surprise because those two are different things, but of course they are related to each other.
But they are related to each other. That's really very interesting research that you are doing. And I also noticed in your poster presentation, you were talking about something called as free hugs. And that was what attracted me to this young researcher, as to, what an innovative research he was doing. And he was trying to see what is the difference between people who give and accept free hugs and people who are a little reluctant to do that. So, what is that research about?
Sure, I'm going to give some context.
Yeah.
So the free hugs movement was created by someone called Juan Man from Australia.
Okay.
And this person
But
was.
the name sounds Chinese.
I thought it sounded Hispanic, really,
Yeah.
because Juan, Juan.
Okay.
I don't know. I have to read up on that.
Yeah.
And so that person thought, well, sometimes people are very down. Sometimes people need a hug. So why not create a campaign where people will go around different conventions, different parties and so on, and show a sign where you can see free hugs.
Free hugs, and but then isn't it very artificial? I mean, you would like to get a hug from a person whom you feel intimately about rather than a hug from a stranger.
Yes, but such a person is not always available. Right?
Yeah.
And sometimes you really need it. I wouldn't be surprised if a lot of people could relate to a story where they were very down, they were crying perhaps after a breakup, and they just needed that hug from anyone, and they couldn't get it.
Yeah.
And this would be the thing that instantly would make them more joyful, or perhaps just less sad.
Yeah.
And that was the motivation behind creating this campaign, for people
So,
to have this.
So you mean to say that hugs have a therapeutic value?
Yes, they have been shown to make ourselves feel better, reduce stress, create more joy, make us less sad, but also on the biological level, there are studies which show that women after pregnancy who are more touched, more hugged, had lesser inflammatory symptoms.
Wow. So the psychosomatics of receiving and giving hugs.
Yes, they are very useful. If we want to be healthy, we should hug. Of course, there are also people who do not like hugs, and this could be related to some trauma.
Exactly. Something that is wrong in their childhood, where, and that takes me to Dr. Eric Burns' theory of transactional analysis that I was talking to you about, where he talks about something called as stimulus hunger. That a child doesn't only feel discomfort and distress when he's hungry or he's physically in some discomfort, but also when he needs some physical stimulus from the caregivers. And the stimulus hunger is known to be present in all of us. We need, even a touch or a pat or a ruffle in the hair would be good to have, if not a full hug. And I have had this hugs at the end of my workshops, and it has been uh, really appreciated by even by large groups of people, of 100 and 150 people, where I really agree with you, and I'm so happy that the research evidence is proving. So do you think that we can call it hug therapy?
Yes, and we can even see there has been some research done on hug therapy and just in general touch therapy, and it seems to work. It seems that people who were very alone, when they get a hug from a person that has been prepared to hug and touch people, they feel better in the long term. People who are very alone now say that they do not feel so alone anymore.
But then, what is the role of consent over here? Because they need to really feel safe with the hug or the hugger.
Yes, so you should always ask, of course. Even when someone offers a free hug, you shouldn't really just approach them and hug. You should always ask them, because you have those people who show great trust in humanity in general,
Yeah.
because they offer themselves, their intimacy, to support others.
Yeah.
And now someone approaches and just hugs them too strongly. And what information does that give to that person? I think a very negative one, and perhaps they will be very discouraged to hug in the future. So consent is something that we need to remember always, from both sides.
From both sides, yes. And also, one more thing is there that, when you are hugged, uh, you might be feeling many different emotions. And for example, we were talking about anticipation, and one related emotion is anxiety. If I'm already perceiving threat in my surroundings, or maybe people or how they treat me, I might not be so open to hugging. Whereas if I'm feeling lonely or sad, I might be more open to hugging. So it might be, different emotions might also play a role over here.
Yes, definitely. When I think about stressful situation where I was angry, I don't think I would have wanted a hug.
Yeah, I would push away people. I would like to be,
Yes.
left alone.
Perhaps I would like someone to talk to me then,
Yeah,
but not necessarily hug, because anger is a confrontational emotion, right?
exactly.
And when I was sad, I would like a hug.
Yeah.
When I was joyful, I would like a hug. When I was scared, perhaps not so much, because I anticipated danger.
Correct. Yeah. And so, what would you say about therapists hugging their clients?
A therapist? Yes.
Would you like to recommend that?
I don't think I'm that much of a practitioner. I was always more interested in research.
Yeah.
But I think there's a lot of potential in therapeutic hugging, but it needs to be really well prepared, and we need to prepare therapists to do that, because that's a very new field of research, and there's a lot of potential for error, for trauma, and so on.
For error, for trauma, and also for the boundaries to get blurred, because a therapist may give a message that you can depend on me for getting hugs, and it may, so for example, in therapies where we are having a contract where we are helping the client examine themselves, their own thoughts, evaluating their conduct or their behavior, and the therapist is taking a bit of a confrontational stance, it might become a little difficult for the therapist to continue that kind of conversation after giving the hug, maybe, and
Yes.
so it has to be done really carefully.
Yes, I think people will need to learn how to distance themselves.
Yes.
Also, I see the danger of perhaps some patients, some clients, could be after a breakup, could seek new relationships,
Yes.
and they could misinterpret the hug
Exactly.
as
Exactly.
love,
As love.
as perhaps permanent friendship.
Yeah.
And that could be a danger, because a patient, a client, can of course create in the future a relationship, a private relationship with their therapist, but it's
during
not the best.
During the therapy, it can be tricky.
Yes, it can be very tricky.
Yeah. So although we know that hugs are good, they are beneficial, they are going to take a lot of weight off the shoulder of a person who is feeling lonely or isolated and sad, but we may not do in therapy, and be a little careful, and maybe doing a dialogue with the client about the hug, saying that I feel a hug would be helpful to you. Do you need a hug? And I could offer a hug to you right now, but then also being a little careful about it.
Yes, yes. And it is also possible that a touch therapist could be a different person.
Exactly, that crossed my mind. You know,
Yes.
you can have another person giving that hug instead of you giving it
Yes,
yourself.
yes, because if there was only one person, then we have that problem that you have someone you touch very intimately and tell everything
And then,
to,
yeah,
and that's very close to love, a romantic
yes,
partner or friend.
yes, exactly. And maybe the people who are accompanying the client can be utilized for doing that. You know,
Yes.
so in couple therapy, we usually do that. Dr. John Gottman recommends a 6-second kiss between the couples every day. And maybe, you know, sometimes when they are in that vulnerable or emotional situation, sitting together, uh, we may, you know, recommend or suggest that why don't you come close and maybe give a hug to each other.
Yes.
That person itself, or maybe if it is a family therapy going on, the parent and the child, maybe, you know.
I also think that this could be a great opportunity to relearn hugging,
Yeah.
because sometimes when couples are 20 years together, they forget to tell each other that they love each other, or to
Exactly.
hug or to kiss,
Yeah.
and
Yeah.
then they can see that that's great. Why did we stop doing that?
Yeah, yes. So I'm so happy that, you know, you thought about this and you started your work on this, and I would like to be in touch with you to see the progress, and we'll keep meeting and talking on online platforms, and I would like you to also conduct some sessions for us in the future. So all the best for your ongoing research. Thank you so much for talking to
you.
me. Thank you.
Thank you.
Thank you.